I am delighted to be able to join you today for this first meeting of the Armed Forces Community Research International webinar series and have the opportunity to explain how one of our sponsors, the Royal College of Nursing, supports the Armed Forces nursing personnel to provide the best care for our Armed Forces patients and veterans. My role in the college is Chair of the Defence Nursing Forum, which is one of the many building blocks of nursing capability, advancing nursing through the college and professional community. In the next 10 minutes or so, I would like to tell you a little about the college, how it facilitates the Defence Nursing Forum, promoting the health and well-being of the Armed Forces community. I will outline how members lead the work of the college by driving projects, research, webinars, resources, consultations, representations, subject matter expertise, and member engagement for the benefit of the Armed Forces community, with some context how the Royal College and the Defence Nursing Forum came into being. The Royal College is the main professional body in the United Kingdom dedicated to advancing nursing practice, and with 450,000 nurses, student nurses, midwives and nursing support worker members, it is the world's largest nursing union and professional body, carrying out work to promote excellence in practice and shaping health policy, as well as being a trade union. The latter trade union function can have challenges for Armed Forces personnel who are not lawfully permitted to engage in strike action, and trade union representation is not permitted during Armed Forces complaints procedure. However, where the Royal College really helps is where Armed Forces nurses meet challenges with their professional practice, and the Royal College have subject matter expertise for these special to type professional practice concerns. And the Armed Forces policy actively encourages engagement with the trade union representatives for transparency, openness and honesty of proceedings. You may wonder the rationale of the unusual combination of the professional body and trade union, and a little history will help us understand. The Royal College was formed in 1916 to set up a register of trained nurses. At that time, registered nurses had to be female. The College of Nursing received its Royal Charter in 1928 and became the Royal College of Nursing in 1939, when Her Majesty the Queen Elizabeth II became the patron. American historian Susan Reverby portrays nurses as ordered to care in a society that doesn't value caring work, illustrating the ongoing discrepancy between the perceived need for nurses and society's willingness to pay for their services. In the book A Voice for Nurses, A History of the Royal College of Nursing, 1916-90, co-authors Susan McGann, Anne Crowther and Rona Dougal offer a lens through which we can examine how similar tensions played out for the British nursing profession over the 74-year period. The Royal College of Nursing had set out to establish nursing as a profession, with a distinct body of knowledge and the desire to control and regulate nurse education. To achieve this, the Royal College found it had to focus upon improving the conditions for nurses in the workforce, a key strategy towards professionalisation. It was this dual focus that positioned the Royal College as a labour negotiator for British nurses, and ultimately saw its registration as a trade union in 1977. The Royal College prides itself on being the voice for nurses today when faced with similar challenges, such as safe staffing ratios and pay disputes. The Royal College continued to grow after the Second World War in the form of local branches throughout the country for communication and windows into nurses' working conditions. With the creation of the National Health Service in the UK in 1948, nurses became public employees, and the influence of the Royal College of Nursing diminished as its voice for nursing in the workplace. Educational reforms were a key strategy for nursing recruitment in the 1950s, now permitting married women and men to become registered nurses. As the challenges with workforce and conditions grew, so did the college strategy of education and unionism. which continue to function today as a voice for nurses in national campaigns, lobbying government and professional networking, providing education and networking groups such as the professional forums. Members of the college elect to join their regional branch for geographical networking and specialist interest groups or forums such as the Defence Nursing Forum, which is one of 35 forums covering areas such as education, research, women's health, as well as clinical specialties such as general practice, pain, palliative care, and children and young people. In June 2004, the Royal College endorsed a call from the Matrons-in-Chief of the Royal Navy, Army and Royal Air Force to have a requirement for a forum that positively recognises the special needs of the armed forces, and Professor Alan Finnegan became the first chair of the Defence Nursing Forum. The forum welcomes regular and reserve serving nurses and healthcare assistants, civilian nurses employed by the Ministry of Defence, retired members, nursing students, civilian colleagues, and all those interested in armed forces nursing. Questions were asked why Defence needed its own forum. The response was to embrace the operational imperative of the need for going overseas, building a medical treatment facility, contending with the problems of the environment, in addition to any military hostility. The morbidity of the patient population may be extreme, yet the patient may feel like one of the family. Even more important, that the family can pull together. The forum was keen to enhance the visibility of the armed forces nurses within the profession, and I have particularly enjoyed working on joint forum projects, such as with membership engagement and governance where this can be achieved. The forums provide a focus for members to participate in professional activities, such as workshops and webinars, recent ones on resilience and future ones planned to look at global health security, provide a focus for Royal College activity within the specialist area of interest, such as producing a publication for nurses new to defence, providing a structure within the Royal College for those specialist areas of interest and their associated accountability. And I'm delighted that the Defence Nursing Forum is the college's subject matter experts for armed forces serving personnel and veterans who contact the college looking for advice and guidance. We have recently designed a guidance note to assist any armed forces nurse undergoing fitness to practice challenges of how they can utilise the Royal College of Nursing trade union representatives, as well as the legal, coaching and counselling advice from the Royal College's support lines. The forums encourage all armed forces nurses to become involved with the Royal College and engage with each other to improve their knowledge, skills and practice. We've just published 6 blog posts from Army healthcare assistants on our website about their additional duties during the COVID-19 pandemic, which ranged from family liaison to running PPE training in some of the busiest hospitals. In the United Kingdom, the forums have the opportunity to work across the 4 countries of England, Wales, Scotland and Northern Ireland to share good practice, such as the Cadet Nursing Scheme, where 16-year-olds are welcomed into the healthcare world to look at opportunities that may be available to them. Academically, the forums lead the development of work in specialist areas. Dr. Janet Kelly will be presenting and publishing her articles on the needs of veterans' families and the challenges of PTSD in the BMJ Military Health early next year. Undertaking our own research, we collected oral histories from defence nurses in Iraq and Afghanistan, which remain both a written and oral resource in the Royal College Library. It's interesting to listen to these oral histories against those of the First and Second World Wars and see the similarities and differences. We aim to bring armed forces research evidence to members of the Royal College, and strongly supported by the library service with e-books such as Military Medicine in Iraq and Afghanistan, and full text editions of the BMJ Military Health. Armed forces nurses may have particular challenges with geographic mobility and may find themselves in areas without easy access to Wi-Fi. We aim to make accessibility to research evidence as easy as possible. We provide literature reviews on armed forces nursing and champion our members who have published articles recently, such as Lieutenant Colonel Linda Mathias, who published on primary healthcare, and Major Pete Royal, who published 2 articles in the BMJ Military Health about the role of the military nurse practitioner on deployed operations and his experience of providing primary health care from the back of an armoured vehicle, constantly on the move. We exploit social media to reach members with research and with Royal College consultations, such as the current consultation on the apprenticeship standards for a specialist clinical practitioner. This is an area where Armed Forces has experience of specialists and experienced personnel over many deployments. We may collaborate with other forums on joint projects, such as the Flight Nursing webinar event this week, and a Leadership and Management webinar in Investing Yourself as a Leader on the 5th of November. We will be working with the Research Society on competency assessment and undertaking some webinars of our own to promote the national initiatives of the Armed Forces Covenant and Employer Recognition Scheme. Our general practice colleagues have already undertaken over 100 presentations to 4,500 general practice and practice nurses across the UK. The forums propose agenda items for the annual Royal College of Nursing Congress for discussion or debate, resulting in the Royal College of Nursing taking the agreed results of those discussions and debates and putting them into the college strategy. The forum proposed that the cultural health needs of armed forces and veterans personnel were included in the national curriculum for nursing, long before the Armed Forces Covenant came into being. The Royal College of GPs, for example, has the requirements of the Armed Forces Covenant in their exam. Since 2008, war pensioners injured by military service should receive priority treatment compared to those of a similar clinical condition. Our next Defence Nursing webinar is looking at opportunities in primary health care and how veterans can be more easily identified and more successfully signposted to sources of assistance. Healthcare differences between the civilian and armed forces sector see differences in the social norms of geographic mobility, the use of exercise and alcohol, stigma in mental health, despite very low medical discharge and PTSD rates. Veterans are unused to the NHS system. Life is very structured with free prescriptions, dental care and appointment bookings. The one-stop shop for veterans, the Veterans Gateway, is a source of information, advice and support for healthcare, housing, employability, finances, personal relationships and more. Thank you very much for listening to our presentation today. For more information, please do get in touch and please follow us on Twitter, on Facebook and on our Royal College of Nursing webpage. We look forward to seeing you again. Thank you.